welcome to Simulation. My name is Rowena Saba and I'm the Simulation Program Coordinator. Right now, we're going into one of our simulation adult rooms. Right here, we can see all the patients are allergic to betadine and ink. So before touching the patient, we have to go put gloves on, which will be located on the wall here. So all the hand hygiene would be here. We ask that you wash your hands, hand sanitizer, and put some gloves on. We have drawers all labeled here with supplies. Here's an example is oxygen drawer, which will have all the oxygen masks, cannulas that you would need for oxygenation. So all along here is the supplies you would need for your simulation. Needles, syringes, and other small supplies. On the top counter here, we have some more supplies. Here is where the medications for the simulation will be. We have alcohol prep pads here, the AccuCheck, and we have an injection pad. We use the injection pad to simulate if an injection needs to be given, so we can put it near the simulator or SimMan, and they can inject into the pad instead of the actual SimMan. Every one of our simulation rooms will have a working IV pump. We'll have simulated IV fluids running to the patient, and we'll have the rate on here according to the scenario we have running. In the back here, we have a sharps container. And then over here, we have our patient monitor with all the current vitals. And the only thing that needs to be recycled is the blood pressure. And we push it right there. Next to the patient bed, we have a drawer here. In here, we have bedpans, emesis basin, urinals. On top, we have our incentive spirometer, nebulizer mask, pen light. Above that, we have oxygen, air, and our suction connected to our suction canister. And this whole unit is functional. We'll move here to our thermometer, which also works as well. We have the whiteboard here that has a room, date, time, operator, and the doctor listed according to the scenario. If you need to get a hold of the doctor, you would call the operator from the phone here. We ask that you use the speaker button, which is located on the right-hand side here. Right next to the phone, we have our laptop, which is our EMR. Listed are the tabs for the patient information, doctor's orders, MARS or labs that you would need to use. This is our main adult mannequin, SimMan 3G. As you can see, he will blink. His pupils will react to light. He has pores on the side of his eyes, his nose, and mouth for tears, for sweat, and frothing of the mouth. As you can see, his chest rises, and you can hear realistic heart, lung, and bowel sounds. He has a permanent IV on his right antecubital, and he also has pulses located at the carotid, bilateral radial pulses, femoral pulses, popliteal pulses, and pedal pulses. The bed that SimMan is on is a real hospital bed that can be raised. Head of bed can be raised up. And right below the bed, we have a CPR lever that will lower the bed completely down.
SimMan can be intubated with an endotracheal tube as well. The patient can also be criked.
Here is one of our code cards. On the top, we have our simulated defibrillator, the defibrillator pads, and a laminated code sheet here. Each of the drawers are labeled. Here's medications, breathing and airway, IV supplies, IV solution and tubing, cardiac and chest procedures, an Ambu bag and masks. On the side of the cart, we have our backboard and a stool. If you need to perform CPR, please roll the mannequin onto his right side. This will prevent damage done to the mannequin's cords.
On the other side of the one-way mirror is the simulation control room. Here, faculty and staff will sit to control the camera operations, as well as the microphone, which will be used as the patient voice. Additionally, this laptop computer is actually used to control the various mannequin features as described in the room.
This concludes our orientation to our adult mannequin room. Thank you for watching, and we look forward to seeing you in simulation.